gusto ko yung clarify ng bone disease aspect. Okay? So, today we're going to talk about hypertension and obesity and overweight. Okay? So, obesity. So, sinadya ko siya. Obesity, medyo hindi na siya kasya.
Aray! Mga inubo yung mga...
Okay, so... sa 10 tao na nakakita niya sa isang araw, no judgment ha, ilan yung nakikita niyo medyo siya?
Saan na mga tatlo?
Kasama nila ako.
Aray huwag ka nang magbilang dyan.
Kasama nila ako, sir. So medyo madami din tayong mga kapwa Pilipino na lumalaki na, no? So, marami din na medyo nagpapaganda ng katawan. So, mas madami yung medyo malaki. So, pag-usapan natin yung ano yung process kung bakit medyo nagkakaroon ng paglaki ng weight or nagkakaroon ng pagkaba. Okay? So, let's talk about obesity. Okay? So, worldwide, obesity has more than doubled since 1980. So, in 2014, more than 1.9 billion adults 18 years and older were overweight. Of these, over 600 million were obese. Okay, so mas madami yung overweight kesa sa obese. Mas madami yung papunta pala. Bakit? Okay. Sana walang negative connotation. Yung obese daw kasi hindi na nakakabalik. So, medyo okay. So, hindi nagpa-follow yung medyo mga obese sa ina-advise ng doctors. Although may mga iba din na nagpa-follow, pero medyo mahirap. Kailangan medyo religious yung pagsunod sa mga directions ni doctor at mga healthcare professionals. Okay? So 39% of adults aged 18 years and over were overweight in 2014 and 13% were obese. So most of the world's population live in countries where overweight and obesity kills more people than underweight. So kung dati sabihin natin 10 years ago, medyo problema ng government, hindi lang sa Philippines, all around the world, yung mga taong kulang sa nutrition. So yung mga batang pinapanganak ng malnourished, ganyan. So maraming namamatay. Pero ngayon daw, mas madami nang namamatay na overweight or obese kaysa sa mga malnourished or undernourished ng mga tao. Okay? So 42 million children under the age of 5 were overweight or obese in 2015. So 3 of 10 Filipino adults are now obese. Okay? According to the National Nutrition Council or NNC. So the number of obese Filipino adults increased by 14.5 percentage points from 16.6% in 1993 to 31.1% in 2013. So ngayon 2016 na, hindi pa available sa public yung current stats natin, but I'm sure mas madami na. Okay? Mas nag-increase. So obesity is genetic but preventable. So at the end of the day, choice pa rin. Okay, kung nakatira ka na kaharap ng bahay mo si McDonald's at si Jollibee, tapos katabi mo si Salad Stop, you know, choice pa rin natin kung tatawid tayo or dito lang sa neighbor. Okay? So ano ibig sabihin nito?
Hindi na ang lifestyle ngayon no? Mahilig na tayo sa fast food.
Okay? So,
Lagi
ibig
nagmamadali.
sabihin nito, mas madami daw according to studies, okay, based on statistics, mas madaming babae na
Obese?
Bakit kaya?
Mas malakas sila.
Mas malakas yung metabolism. Mas malakas yung metabolism.
Ay, hindi kasi...
Mas stressed sila.
Mas stress. Sige, pwede.
Tsaka ako kunyari nanay ako. Ako kunyari nanay ako. Lahat ng tira ng anak ko ako kumakain.
Sila yung isa malakas talaga kumain yan.
Oo nga, kahit walang tira.
Mas malakas yung metabolism ng boys.
Boys.
Okay, so based on studies, no?
Hanggang sa kalsada
mas madaming
kumakain.
obese na female kaysa sa lalaki. So, yung nakita nilang reason dito kasi, for example, in a typical Filipino family, si mommy ay domestic engineer. So, housewife. Okay? Prepare siya ng food sa bahay, hindi na siya konti. Pero si husband, nag-work, umaalis sa bahay, 8 to 5 trabaho, nata-traffic pa, nakakadating sa bahay mga 9 p.m. na. Pero basically, mas madaming physical activity si husband. Now, kung sabihin natin may 3 kids ni mommy, si baby, laro ng laro. So, lahat ng natitira ni baby, isipin ni mommy, sayang naman yung pagkain. Effort yun, niluto ko buong araw, di ba?
Huwag magsayang ng pagkain.
Kesa itapon natin. So, yun yung nakikita nilang reason kung bakit nakakapag-contribute na factor kung bakit mas madami daw females, okay, na obese kesa sa lalaki. So, basically, dun sa physical activity. Okay? Although, syempre, ngayon, makikita natin may mga mommy na nag-engage in physical activities. Nag-ipunta sa gym, or may mga videos sa Facebook na kahit nasa bahay, nag-aalaga ng kids, naghahanap pa rin ng ways para makapag-exercise. Although, pero syempre, sabihin natin sa 10, siguro 2 yung gumagawa na. Yung 8,
Stress.
Never mind.
Nagpakain sa stress.
Never mind. Stress eating.
nagtatrack kay husband kung nasaan na. Ayun.
Hindi kasama sa agenda ko yun.
So, overweight and obesity. Nagagamit natin siya interchangeably. Okay? So, sabihin na, overweight na ako, obese na yata ako. So, hindi ibig sabihin na overweight ka, obese ka na. But if you're obese, definitely you are obese. Okay? So, according to WHO, overweight and obesity are defined as abnormal or excessive fat accumulation that impair health. Okay? Parehong hindi healthy. Madaming fat accumulation. But meron silang tinatawag na body mass index or BMI, okay? Which is a simple index of weight for height. Kailangan lang ng height mo, tsaka yung weight mo in kilograms para makompute mo yung BMI. Okay? So, sabi ni WHO, according to WHO, a BMI greater than or equal to 25 is overweight. Pero a BMI daw of more than or equal to 30 is obese. So, sa ibang reading, siguro makakabasa tayo ng obese class 1, obese class 2, may obese class 3 na. Ayun. So, 25, equal to 25 or above, pero hindi pa abot ng 30 overweight. Pagdating mo ng 30, obese ka na. Okay? Obese class 1. Pagdating mo ng 35, obese class 2. Pagdating mo ng 40, obese class 3. And unfortunately, meron na tayong mga obese class 3. Okay, so 40 and above na BMI, class 3 na siya. So ito yung, actually class 2 and above, ito yung mga sinasuggesta na ng bariatric surgery, no? Kailangan na ng surgery, papalitin si stomach, or lalagyan ng parang band para konting kain lang busog ka na. No? Or i-redirect si intestines para konting kain mo lang, hindi ako na busog na. No? So, as a result, okay. Pero hindi pa rin siya enough kasi kailangan coupled siya with exercise. And then, syempre, coupled siya with other surgeries. Kasi pumayat ka nga, nag-sag naman yung skin mo, di ba? Tummy top. Diba? Okay? So, what are the causes of obesity and overweight? Being overweight. So, the fundamental cause of obesity and overweight is an energy imbalance, okay, between calories consumed and calories expended. Mas madami yung kinakain mo kaysa dun sa ginagawa mo activity. Kumain ka ng 2 burger ngayong gabi, bukas, natulog ka ng buong araw. Diba? So, okay lang sa mga, pansin nyo may mga tao, lalaki, babae na grabe mga kain, ilang bandihadong kanin, pero halos hindi ito bataba. May mga nag-gym rin na sobrang daming kain, pero hindi naman tumataba. Pero kasi kailangan nila yun. Sa dami ng ginagawa nila sa social life or sa kinakain. Okay? Hindi ibig sabihin na yung nanay mo, tatay mo, may diabetes na. Oh my God, diabetic na rin ko. Okay. But it's possible. Okay? Kasi 2 klase si diabetes. May type 1, type 2. Okay? Musculoskeletal disorders, osteoarthritis. Okay, sobrang bigat. Okay? So sobrang nakaupo ka na lang whole day, hindi mo na na-exercise si joints. So nagde-develop ka ng mga osteoarthritis. Mahilig ka pa sa munggo, sitaw, beans. So nag-accumulate tayo ng uric acid. So tumataas yung chances na mag-develop tayo ng osteoarthritis. And some cancers, endometrial, breast, and colon. Okay. So the risk of these non-communicable diseases increases with an increase in BMI. So childhood obesity is associated with a higher chance of obesity, premature death, and disability in adults. So okay lang yung babies na medyo chubby, kasi cute. Pero pag lumaki, at some point kailangan natin silang i-diet. Kasi sila din yung mahihirapan pag lumaki na sila. Okay? So marami yung mga complications na pwede mag-arise. Okay? Ang hypertension later, i-discuss natin, hindi na lang siya nag-occur dun sa mga 30 years old and above. So meron tayong nakikitang patients as early as 14 years old na nagba-basketball lang, bigla na lang bumabagsak at namamatay dahil sa hypertension or heart diseases na hindi congenital. Okay? So anong pwedeng gawin at the personal level? Limit energy intake from total fats and sugars. Increase consumption of fruits and vegetables, as well as legumes, whole grains, and nuts. So may dalawa kang plates. Yung isa, salad. Yung isa, Zark's Burger. Sabihin na lang natin, pareho silang, mas mura si Zark's. Sabihin natin 150. Si salad 300 per serving. Ano pipiliin niya? Zark's? Zark's kasi mas mura. Pero hindi healthy. Yun lang yung problem kasi yung mas healthy na food, mas mahal. Diba? Konti lang yung serving.
Yung mga nandamon.
Ilang daon lang, ano na, 300.
Gulay, pwede pa. Pero saan?
And engage in regular physical activity, 60 minutes a day for children and 150 minutes per week for adults. Okay? So yung malapit lang na market sa bahay, huwag nyo nang i-tricycle. Yung isang floor, dalawang floors, huwag nyo nang i-elevator. Steps na lang.
How about coffee, Doc? Yung masyadong sobrang
Mga larawan at kape.
Well, coffee,
yung
ibang
20
sakit.
size. Yung 20 size talaga.
Well, you can develop gastritis,
Ah, okay.
meron family history.
Oh.
Buti nila ang kape ko, pandamig.
But if you're hypertensive, tapos may ka sa kape, pwede siyang maging factor.
Ayan, magtatanong ako mamaya sa hypertension.
Okay?
Kasi ang kape mo mainit.
Hypertension. So 21% of Filipino adults are hypertensive, according to the Philippine Society of Hypertension. Okay? So 1 daw, 3 out of 10 high blood. So sino yung high blood? Sana.
Sandalisa.
Yun, sir, paano yung paano
Siya lahat yan.
Siya lahat yung sakit.
Grabe kayo!
Ginamay lang po kami. Ginamay lang
Paano
po
talaga
talaga.
natin kung hypertensive ka na?
Oh,
Kasi ako like, genetic, hereditary. Yan yung talagang ano ng family namin, high blood.
so you have, you get to have your BP checked
Kain
sa
pa ba?
nurses or kung meron tayong kapitbahay or relative na may pang BP.
100/80 lang ako, excuse me.
Well,
So,
BP yun.
pag meron tayong family history, the more na kailangan natin check ng blood pressure. Minsan kasi, yung hypertension, wala siyang symptoms. Walang pananakit ng ulo, walang pananakit ng bato, hindi ka kinakabahan, feeling mo okay ka. Yung mas nakakatakot kasi parang how do we call that, walking bomb.
Pero besides the BP, ano pa po yung pwedeng pang-test if you're
Hindi, Marisa.
BP lang talaga.
Kaya ko sagutin yan. Huwag kang mag-i-invite ng mga pasaway. Yun lang.
para di ka ma-high
Pero ako
blood.
na-stress.
So hypertension causes 7 million deaths every year, while 1.5 billion suffer due to its complications. Okay, so madami din. That's according to WHO. So it is a condition in which the blood vessels have persistently raised pressure, putting them under increased stress. So pag mapapansin nyo, pagkakapain nyo yung pulso nyo, may gumaganyan-ganyan. Isa lang yan sa maraming klase ng blood vessels. Yan, artery yun. Okay? Yung blood vessel natin na walang pintig-pintig or walang pulso, veins ang tawag doon. Okay? Pareho affected ng mataas na pressure ng dugo. Okay? So, sa practice ko, meron ako na-encounter na mababa po kasi yung dugo ko, anemic ako. So, magkaiba po yun. So, kailangan natin ma-delineate yun. Okay? Pag sabihin natin anemic, okay, yun yung mababa na pagkapula ng dugo. Pansin nyo, sa pag-CBC natin, pinakauna hemoglobin. Yun yung pagka-red ng dugo. Pag mababa yun, doon ka anemic. Okay? Si blood pressure iba pa. Yun yung lakas ng daloy ng dugo na dumadaan sa blood vessels or ugat natin. Para siyang gripo, tubo ng tubig. Okay? Yung dumadaloy na water, pag open mo, kung sobrang lakas, yun yung blood pressure. Okay? Iba pa yung pagkapula ng dugo. So, wag nang ma-confuse yun. Anemia
Pwede
sa
kang anemic pero hypertensive ka.
Pwede. Pwedeng mababa yung pagkapula ng dugo, pero malakas yung pressure niya. Okay? So, normal adult blood pressure is defined as a blood pressure of 120 millimeters mercury when the heart beats. Okay, taas, 120 pag nagbi-beat si puso, and a blood pressure of 80 millimeters mercury when the heart relaxes. Love-dub. Love-dub. Yung first na tube, yung 120. Second na tube, yung 80. Okay?
So, doon ano yung delikado po na delikado pag tumataas? Yung
Actually, sa practice, range siya. Hindi lang yung tipong 120-80 beat ko, normal. 119 over 79, ay mababa na. 121 over 81 ay mataas na. Hindi po. Range po yun. So, 90 over 60, papuntang 120 over 80. Nasa nandun ka sa loob naman, okay yun. Anything na mas mababa sa 90 over 60, anything na mas mataas sa 120 over 80, hindi maganda. Okay? Pero depende pa yun sa edad. Kasi kung bata, iba pa yun. Okay? Kung adult, iba pa yun. So, meron tayong mga sinusunod na mga... May mga sinusunod tayo na guidelines.
Tabi mo bata.
So, the higher the blood pressure, the higher the risk of damage to the heart. And blood vessels in major organs, such as the brain and kidneys. So, hypertension is the most important preventable cause of heart disease and stroke worldwide. So, ang pagiging high blood, marami po siyang complications sa brain, sa kidneys, okay, sa mata, sa periphery natin, sa mga paa, sa mga ugat sa paa. Okay? Kung mapapansin nyo, kung meron kayo salamin na slagaligid, kaya hindi. Sabi kong varicose veins, si hypertension nakakapag-contract.
wala akong varicose veins. Maganda pa rin.
So, nire-relate talaga ni Master.
Para ako nag-check up na ng ano ngayon.
Papacheck up.
Papacheck up ako.
So, 5 concrete steps to minimize the odds of developing high blood pressure and its adverse consequences. Una, healthy diet. Mahal kasi ng healthy diet. Okay. Yung healthy na pagkain sa ano pa, sa Rockwell ko na display.
Tama.
Pwede naman sa ano, balintawak.
Pwedeng
Agahan mo lang. Okay. So, number 2, avoiding harmful use of alcohol.
Ay, hindi ako
So,
nag-drink.
limit intake no more than 1 standard drink a day.
Hindi ako naninigarilyo.
So, nag-a-apply dito yung anything in excess, hindi maganda.
Pero
Okay lang naman si alcohol.
excess
Okay lang
ng
daw.
drink, ay excess ng veggies and fruits,
Oo.
di ba, Dok? Okay lang.
Kasi studies have shown that alcohol is actually good for the human. Sabihin natin, example lang, a construction worker na sumasahod ng arawan, in a week or in a month, nakaka-4 na beses uminom every Friday. Diba?
Friday pay.
Or kahit yung mga corporate na dun sa corporate agencies na work, so every Friday lalabas. Pero hindi lang yan alcohol. May kasamang yosi. Diba?
Kulot.
Okay. Number 3, physical activity. So hindi naman kailangan pumunta sa gym. Hindi yung tipong wala kasi akong pang enroll sa fitness first or sa Gold's Gym.
Gold's Gym na lang.
Kahit anong physical activity ko na mapagpapawisan kayo.
Uy, nag-jogging ako.
Grabe.
10K.
Okay na po yun, makakatulong.
1.5
kahit
hour.
pa.
Nakabuo ka doon.
Okay. Number 4, stopping tobacco use and exposure to tobacco products. Okay. Number 5, managing stress in a healthy way, such
Kasama ba
as
din?
through meditation, appropriate physical exercise, and positive social contact.
2 hours.
So, wag nilang stress yung mga hindi kailangan stress. Kasi stress, you mentioned kanina, di ba, na-contribute din siya.
Kailangan ako sa ganyan.
So, hypertensive ka na. Alam mo, may idea kang hypertensive ka, pero hindi ka nagagamot. Yung idea mo, nakuha mo kasi si mama at si papa, hypertensive. May mga times na sumasakit yung batok mo. Ikaw yung tipong tao or ikaw yung may type na personality na bilis ka mairita. So, nasa work ka, may nakasagutan ka. Yung event na yun, pwede siyang maging factor ng pag-shoot up ng BP mo. Okay? Kapag sagutan ka, kinonfront mo yung mga ganun. So, yung mga ganun na maliliit na bagay, kung maiiwasan, iwasan na lang.
Pwede.
Kung meron kang
So, mag-in ba ito?
meditation na alam na parang diba? Wag na. Wag ka na mag-engage sa ganyan. Kung alam mong pwedeng pumas. Kasi may mga pumupunta dito, nag-hyperventilate, hindi kumakain na, Dok. Bakit? May nakasagutan ako sa opisina eh. Kunin namin yung BP. Slightly elevated or elevated. Sige ma'am, relax muna kayo. Eh, hindi siya known hypertensive. So, the fact na medyo tumaas, meron kang potential na maging hypertensive or mag-develop ng hypertension. So, yung mga ganyang events, like, kung hindi kailangan naman, gusto ko pumunta ng Megaman kasi pantayin mo na sa hapon, hindi masyadong mainit. Huwag kang magpila. Mega, bukas yung Mega mo lang alas 10, doon talaga ako para mauna. Nasa arawan ka. So, yun yung mga ways na huwag kang makipagsabayan sa marami sa MRT, di ba? Mas maaga kapag gano'n. Uminit yung ulo mo sa traffic kasi late ka na. Kasi late ka gumis eh. Tumaas yung BP mo, yung mga gano'n. Okay? Okay, so thank you. So, if you have questions,
Ayan.
Ayan.
Uy, ba't ako lang? Kayo sobra naman kayo.
Hindi naman mo lang naman kami dito eh. Ikaw talaga magtatanong eh.
Kaya sa mga Pilipinas, sasagot.
as of today,
Answer, Char.
so in relation to this, actually, sudden cardiac death, heart attack, diabetes, hindi pa natin tatanggalin siya in general, accidents, basically, non-familial.
Ako, magugulat kayo, baka kasi meron kayong thank you kit. So we'll be giving it out later.
Wow.
Surprise na lang po ito. And then we'll be showing you a short video regarding our foundation. Ano po yung pinagsimulan ni Aster here in the Philippines. So in the worldwide po kasi yan, worldwide po it's 290 establishments na. So meron po with UAE, Oman, Qatar, Saudi Arabia, Bahrain, Jordan, India, and now Philippines. So, sandali lang po ha, we'll try to show you a video, very short lang po, about the foundation where we're at. Tapos yun, aming operations manager, Mr. Emerson, will talk about EMR.
Hi, good afternoon everyone. Again, my name is Emerson. I'll be talking about what makes Aster different from other clinics. But before that, let me ask you, sino na dito yung nagpunta na ng ibang clinic? I mean, nagkaroon ng check-ups. Okay, I'm sure most of you, if not all, had an experience of check-up. And then, a good majority of you would have had an experience transferring to another clinic. Tama ba? Probably because of logistics, because of preference, personal preferences. Ako personally, I've been from one clinic to another. Kasi yung talk ni Dr. Nico earlier, hypertensive, at saka obesity is close to my heart. Kasi I myself, I'm hypertensive since my early 30s. Hindi ko na yung age, yung age. So I used of early 30s, pero that was years ago. And then right now, I'm class 1 obese. Okay?
Class 1?
Yes. I am class of obesity, katulad ng sinabi ni Dr. Nico, is hindi nyo makikita physically. It has to be measured, it has to be studied well and diagnosed by the doctor. Kasi yung BMI ko, based on my height, I am class 1 obese na. Based on Asia Pacific typical body. Okay? Right now, I'm 180 pounds yung weight ko. The ideal weight should be nasa 150. So I'm 30 pounds overweight. I'm barely 5'8" na. Okay. Usually nira-round off din sa 5'8" parang maganda ko. So based on that, I'm class 1 obese now. So going back to that experience na nag-jump kayo from one clinic to another. Okay? Pag upo nyo sa isang clinic, sa isang bagong doktor, ano usually tinatanong sa inyo?
Information.
Information, correct. No, it could be personal information, but most often, it's your medical history. Which, nasabi mo na doon sa previous doctor mo. Pero dahil lumipat ka ng ibang clinic, hindi nila alam yung iyong medical history. Which makes aster very, very different because we have EMR or electronic medical record. Okay? The electronic medical record would allow the doctors within aster to see your medical record. So, for example, si Ma, nagpa-check up siya, no? Kasi may fever siya today, flu-like symptoms, no? Binigyan ka ng reseta, kinuha ni doctor, let's say, ng internist or ng internal medicine specialist yung history, blood pressure and all, no? Diba? All the works. And then, probably after 2 months, nagkaroon ka ngayon ng parang chest pain, for example. No? Probably after swimming or something, nagkaroon ng chest pain. So you went back ngayon sa aster. Pero different doctor. Okay, ni-refer ka, let's say, sa isang cardiologist kasi nga because of the chest pain. And then you saw the cardiologist will not ask you about your history anymore. Kasi everything is in the record. Okay, mind you guys, when you see a computer in a clinic, it doesn't mean may EMR sila. A computer does not equate to EMR. A computer, sige, hindi kayo manual, pero it doesn't equate to EMR. Okay? We have a full system, no? Functional EMR here in the Philippines. Bakit? Because we have an established company na in the GCC region, which is yung aster, which is corporate office, corporate company. And then, since into clinics and hospitals sila for the past 25 years, ito na yung na-develop. Which is ngayon, very lucky tayo kasi pinasok na agad sa atin. Wala nang trial and error. Everything is set for plug and play here in the Philippines. Okay? So that's how different we are, number 1. Number 2, we are the first clinic in the Philippines to operate 24 hours a day. Okay? So, for working moms, for people who are working after office, pwede kayo magpunta sa amin. If you need laboratories, if you need x-rays, if you need any urgent care after office, punta lang kayo sa amin. Okay? Kasi if you go to the ER after office hours, anong experience yun? Let's say nagkaroon kayo ng fever lang, uncomfortable kayo, fever. Wala na kayong pupuntahan kasi it's 10 o'clock in the evening, wala nang clinic. So, saan ang punta nyo? ER. So, you have 2 choices. Ipagpabukas or mag-ER. Tama? If you decide na mag-ER na yon at 10 o'clock in the evening, ano yung experience sa ER?
Mas mahal.
Mahal.
Ayun,
Number
mahal.
1, mahal. Ano pa? From a patient experience. Matagal. Bakit matagal?
Walang doctor available.
Walang doctor available. And then, isa pa, they are limited by their protocol. Kasi technically speaking, your life is not threatened. Diba? Kasi fever kahit sabihin mo mataas yan, hindi hindi ka basta-basta mamamatay sa fever. So ikaw, isasantabi ka ngayon na triage nurse ng doktor, uunahin nila yung mga na-aksidente, yung atake sa puso, kasi yun yung life-threatening conditions. So in your mind, ano ba naman itong hospital na to? Kanina pa, isang oras na ako dito. Pero if you go to Aster, since we're 24 hours a day, we have 24 hours 24-hour doctors on duty for you. We have 24 hours our nurses on duty for you. Medtech din, radiology. Okay? So if you need anything, andun na agad. Okay? So ibig sabihin, hindi na kayo maghihintay katulad na sa ER. Okay? Sa ER kasi, let's face it, no? Unahin nila yung mamamatay na. Okay? And we don't want to be in that situation, obviously. Okay? Another feature here is that the company is in the works of building 4 more clinics. Okay? Hopefully near your location para convenient sa inyo. And this is also where EMR comes in. Okay? In the works are MOA. We also have Araneta Center. Okay? And we're planning one more in Harrison Plaza. And then one more, we're to be determined pa yung location.
Antipolo nga doon. Walang nagre-request.
Hopefully, no, sooner rather than later, we'll get there. But let me highlight yung features ng EMR. So let's say si ma'am nagpunta ng Mega Mall. Sinamaan ng pakiramdam. Obviously, Aster St. Francis is yung pinakamalapit. And then, let's say si ma'am is from Manila area. So you have Harrison Plaza. Your records na nakuha namin dito is automatically andoon, online. Okay? So si doctor namin doon, hindi natatawag sa Aster St. Francis. Oh, si ma'am ganito, ano bang records niya, anong ganyan. Everything live, online, makikita ng doctors nito. Okay? And we are very, very, I would say, passionate about patient protection and privacy. Okay? This system, okay, if I log in, hindi ko makikita ang medical records ng mga pasyente. If Shelly logs in as a nurse, hindi niya rin makikita yung EMR. Okay? Point is, we only have the doctors who have full access doon sa ating patients' medical records. And we are HIPAA compliant. Have you heard of that, HIPAA? Okay, HIPAA is a law passed in the US wherein the medical and personal information of any patient is protected by law. So we are compliant doon. Kasi dito sa Philippines, very minimal lang yung protection ng patients. So we went above and beyond the standards of the Philippines. So we are HIPAA compliant. So it's a Health Information Protection Act, no, of the United States. Okay? So ito yung highest level of protection or patient confidentiality na available sa mundo. And we are compliant with that because of EMR. Okay? So let me give you a short tour, no?